Hello, welcome everyone. As discussed earlier, we're going to be talking about chapter 18 in your book, which deals with obstetrics, mainly dealing with pregnancy, delivery, postpartum, and all conditions maternal. Let's get started. Okay, and again, one of the interesting things about pregnancy, childbirth, and this chapter is all the codes begin with O as in obstetrics. So this chapter can be a little bit confusing, can require a little bit of understanding of some unfamiliar terms, but I'm sure we'll be able to get through it. And again, the first character of the code is going to be O as in obstetrics, not zero. Some of us, when we were first learning ICD-10 a few years ago, we would actually draw that European symbol for zero with a line through it to make sure that we were clear on all that. And these codes are only used on the mother's record. They're not used on the newborn record at all. And again, it's helpful to know how these codes are organized in chapter 15 of the code book. O00 through O08 is pregnancy with abortive outcome. O09 is supervision of high risk pregnancy, and so on. Later on, we get into the codes involving labor and delivery. So you can see here O60 through O77, complications of labor and delivery, O80, O82, encounter for delivery, O85 through O92, complications related to postpartum period or puerperium, and other obstetric conditions not elsewhere classified. Whoops, sorry about that. Again, most codes in this chapter identify the trimester of the pregnancy in which the condition occurred at the fourth, fifth, and sixth character level. And if you need a refresher on the female reproductive system, there's one here in your text in figure 18.1. And codes for elective, legal, or therapeutic abortion are reported with code Z33.2 and counter for elective termination of pregnancy. Complications from induced termination of pregnancies are found in this chapter as well. And ICD-10 requires a seventh character extension to identify the fetus to which certain complication codes apply, including a seventh character for an unspecified when the fetus affected cannot be identified. And we use characters 1 through 9 for patients with multiple gestations to identify the fetus involved. Zero is used when there's only one fetus in utero. There are a lot of notes in this chapter that direct the coder to code also, code first, and the usual things that we've seen before. And pregnancy is the state of the female anytime after conception till the birth of the child. Normal pregnancies are intrauterine with a duration of approximately 266 days from conception until birth, or 288 days from the last menstrual cycle. Here's some important terms that you need to understand. Preterm is delivery before 37 weeks of gestation. Term is delivery between 38 and 40 weeks. Post-term is delivery between 41 and 42 weeks, and prolonged is any delivery that occurs after 42 weeks. And again, trimesters account from the first day of the last menstrual period, and their definitions are as follows. First trimester, anything less than 14 weeks and 0 days. Second trimester is anything from 14 weeks, 0 days to less than 28 weeks and 0 days. And the third trimester is 28 weeks until delivery. The postpartum period begins immediately after the third stage of labor when the deliveries occurred until the involution of the uterus is complete, which is 42 days after. Any complication from this is considered a postpartum complication that occurs in this 6-week window. When a delivery occurs during admission, the code must reflect that status. Timing matters more than ever in obstetric coding. When the classification does not provide a code with an in childbirth option, it's appropriate to assign a code describing the current trimester. And then we always want to use an additional code from category Z3A, weeks of gestation, to identify the specific week of pregnancy, with 3 exceptions that we'll talk about. Otherwise, we always want to code the weeks of gestation. There are a lot of extensive chapter-specific guidelines that exist in this chapter of ICD-10-CM. Please make sure you review these very, very carefully, including the general rules for obstetric cases, when you use the selection of the principal or first listed diagnosis, pre-existing conditions versus a condition due to pregnancy, pre-existing hypertension in pregnancy, fetal conditions affecting the management of the mother, and HIV in pregnancy. These can get very complicated. Please give them special attention. There are very specific guidelines about diabetes in pregnancy, long-term use of insulin and oral hypoglycemics, gestational pregnancy, sepsis and septic shock, alcohol, tobacco, and drug use during pregnancy, and so on. Please read these guidelines over very, very carefully. And again, some more. We use certain codes for normal delivery and only for normal delivery. We have codes specifically for peripartum and postpartum periods. We have codes for sequela of complications of pregnancy and termination of pregnancy, spontaneous abortion, and now, of course, something fairly new. We have COVID-19 infection in pregnancy, childbirth, and the postpartum. And last slide. Again, these codes begin with the letter O, not 0. The majority of codes have a final character that indicate the trimester of the pregnancy. And again, we have the option to assign in childbirth code as well as current trimester code for delivery. And that's all I have for you. Thank you for watching. Come back for our next video lecture. We'll be talking about codes being used with abortive outcomes, deliveries, and other things with maternal coding. Bye now.